To speak well during your OET speaking test can be little intimidating to even those who are really good at speaking. But don't worry, today I'm here with some tips to help you out. So watch the whole video if you really want to bag good score in your OET speaking. It is going to be a role play. The term role play means you play the role. In our case, you play the role of a nurse and the interlocutor would play the role of a patient or a bystander. Most importantly, you have to sound like a professional and you have to talk like a professional and treat your interlocutor as one of your patients or bystander. You really don't have to treat your OET speaking test as an exam unlike all the other subtests. Rather, it's a medical condition and you just gotta deal with it well. You will be in a professional setting and you will be asked to talk to a patient or a bystander. But never ever assume that the bystander or the patient would start the conversation for you. Yes, it's gonna be you. You are the icebreaker. You know, you gotta keep the conversation moving. Yeah, you heard me. You should not stop. At some point of time, even if the conversation gets stuck or stops in between, it's your responsibility to keep it moving. So you can keep some silence breakers ready with you to use if the situation demands. And I can give you some examples of silence breakers if you want. Could you give me more information about it? Would you like to add something to it? Could you tell me more about it? All these are examples of silence breakers. At some point of time, if your conversation gets stuck, you should be ready with all these kind of silence breakers to make an action. Even if your patient is reluctant, he or she will have to answer all your questions. So your primary purpose here is to keep the patient talking. So you can ask some questions depending upon the situation given in the role play. So certainly it's a medical situation and you can ask questions. So the more questions you ask the patient, the better it is going to be. I can give you some examples on how to ask questions. Do you still feel pain? How long have you been suffering from this condition? You got to understand what your patient is saying, and for that you need to listen to your patient really well. Only then you can gather correct information from your patient and thus provide best pieces of advice. Be humble, be respectful, and always be distinctively understandable. You certainly don't need to talk really fast because speaking fast is never considered as fluency. On top of that, if you try to speak fast, there are high chances for you to sound unclear. So be calm and maintain a moderate rate of speech. During your conversation with patient, you might need to face really odd questions like, I really don't want this injection, can I drink it? In such scenarios, it's always better for you to reply politely. So be ready to face the odds. So if you follow all these tips and practice your OET speaking for a while, you're going to be unstoppable. Happy learning, guys.
Medcity International Academy. Trusted hands forever.